Hello guys, welcome to my channel. This is part 2 of my raising meat rabbit series. So you just finished building your cages and getting some quality rabbit breeds, and you're wondering what's the next step in the rabbit farming. In this video, I'll be talking about all the vaccines you need to give your rabbit and the various diseases the vaccines treat them. This is one of my does. She has rabbit mange disease. You can easily identify it by the dark growth on its nose. In severe cases, you find growths in its ears, loss of fur, weight and appetite. I will be treating the mange disease with ivermectin injectable. It works for most skin-related diseases. As a farmer, this is one of the most important vaccines you should have in your farm. Ivermectin can also be used in treating fungi in rabbits and any skin-related diseases. Do not vaccinate rabbits from 0 to 2 months of age. For rabbits below 2.5 kg, give them 0.5 ml, and above 2 kg, give them 1 ml. Ivermectin is injected directly into the skin. Anywhere in the skin is fine, but I usually prefer to lift the skin up at the back of the neck and administer it. Ivermectin is injected every after 2 weeks. If after 2 weeks you discover your rabbit still has the mange disease, you can inject it this time with 0.5 ml. When injecting the rabbit, please be very conscious not to inject the needle too deep and accidentally touching the bone. It is always advisable to get a vet if you can't do it. The next vaccine I'll be giving my rabbits is an antibiotic called oxytetracycline. It's an injectable and can be used to treat many diseases and bacterial infections like diarrhea. You can also use it to deworm your rabbit. Give your rabbit antibiotics immediately you get them. You never know the disease the rabbit might be suffering from. This rabbit is above 2.5 kilograms, so I'll be giving it 1 ml. You can always give your rabbits antibiotics every after 2 to 3 months. This is an intramuscular injectable, so we will be applying it to the thigh. You can inject it at the lap of the rabbit or anywhere you find muzzles. All the rabbit vaccines I'll be talking about in this video are the ones available in Cameroon and most West African countries. If you are in an area where you can get ivermectin, penicillin injectable works too, or you can visit your vet and get other supplements. These are essential vaccines and you should always have them in your farm readily available. It's not all the time you call the vet to come check on your rabbits. The next vaccine I'll be giving my rabbit is Multivitamin. This is my doe and she just lit out. This multivitamin will help her eat well, thereby producing more milk to breastfeed her kids. I also have a buck who stopped eating, so I'll be giving it some multivitamins too. You give it 1 ml. It's an intramuscular injectable, so we'll vaccinate this one too directly into the muzzles or the lap of the rabbit. Rabbits from 1 to 2 months, you can get a liquid multivitamin or powder multivitamin and mix in their feed. Avoid injecting small rabbits. The last vaccine I'll be talking about today, it's an antibiotic called bioannexin. It's an anti-inflammatory vaccine. If your rabbits have any swollen parts around the body, give them this vaccine from 0.5 ml to 1 ml, depending on how much a rabbit weighs. To avoid piercing your rabbit multiple times, you can combine the 2 antibiotics in a single syringe, the oxytetracycline and the bioannexin. Give your rabbit this if they have any wounds on their body. If you've watched this video to the end and found anything interesting, please consider subscribing to the channel, liking the video, turning on the post notification and leaving a comment. Thanks.